This recording contains part 2 of anemia. The next type of anemia we're going to talk about is folic acid deficiency anemia. And folic acid deficiency anemia occurs when the body lacks sufficient vitamin B9 or folate. Inadequate dietary intake or impaired absorption of folic acid due to underlying health conditions is the root cause. And the problem is it compromises the body's ability to produce healthy red blood cells, essential for oxygen transport. So the problem is the body can't make DNA that it needs, and so the red blood cells don't divide properly. So the cells grow, but they can't divide, and we end up with big, useless red blood cells that can't do their job right. Risk factors for folic acid deficiency anemia include low dietary folate, alcohol use, malabsorption, including Crohn's disease, and certain medications like methotrexate or phenytoin. Common symptoms include the common symptoms that we talked about for anemia. Symptoms are really similar to the symptoms for vitamin B12 deficiency anemia, except this folic acid deficiency anemia does not affect nerve function. Diagnostic tools include looking at the serum folate concentration, a CBC, and a peripheral blood smear to confirm megaloblastic anemia pattern, or again, having large red blood cells. Treatment for folic acid deficiency anemia includes using supplements as well as identifying any underlying cause such as medication interactions or malabsorption. It can be prevented through diet or addressed through the diet, and foods that are rich in folic acid include leafy greens, liver, yeast, legumes or beans, nuts, and citrus fruit. Many foods such as breads, pastas, and cereals have folic acid supplements also added to them. Another thing to think about with folic acid is pregnancy. Maternal folate deficiency is strongly linked to fetal neural tube defects that can lead to spina bifida. So adequate folate intake, especially before and during pregnancy, is the cornerstone of prenatal care. And the key takeaway, folic acid deficiency anemia can be preventable. Early supplements, dietary awareness, public health fortification programs save lives, especially for mothers and newborns. The next type of anemia is aplastic anemia. With aplastic anemia, the bone marrow fails to produce sufficient red blood cells, white blood cells, and platelets, resulting in pancytopenia. Pan meaning everything, cyto, cell, all cells are low. We're focusing on the red blood cells because this is an anemia. Causes include long-term exposure to toxic agents such as ionizing radiation, as well as infections and genetics. Common signs and symptoms include recurrent infections and fevers because of the low white blood cells, easy bruising, petechia, or spontaneous bleeding because of the low platelets, as well as our normal signs and symptoms of anemia because of the low red blood cells. All three cell lines are compromised, and labs are going to show macrocytic red blood cells and decreased reticulocytes. Macrocytic again means big. A reticulocyte is an immature red blood cell, and normally only about 2% of circulating red blood cells are reticulocytes. With aplastic anemia, we see a decreased reticulocyte count, and the low count signifies a failure of the bone marrow to produce new red blood cells. Treatment includes blood and platelet transfusions, as well as immunosuppressive therapy. Also, you may see bone marrow stimulation with growth factors, so that would be medications that actually stimulate the bone marrow to start producing the cells we need to see increased in the blood. Filgrastim is a medication used to stimulate white blood cell production in the bone marrow. The second medication here, epoetin alpha, is a medication used to stimulate red blood cell production in the bone marrow. Remember, aplastic anemia is a bone marrow failure. So aplastic means nothing's being produced. We're not seeing enough red blood cells leading to anemia. We're not seeing enough white blood cells leading to infection. And we don't have enough platelets, which leads to bleeding. In addition to the concerns with anemia for this patient, a priority concern would be infection prevention, as well as monitoring for bleeding and administering interventions such as transfusions if needed. Next, we have genetic anemia, a G6PD deficiency anemia. And the problem with this just genetic disorder is that the red blood cells actually break under stress. So it's an inherited disorder. The red blood cells lack a certain enzyme, and without it, cells can't function normally. And triggers such as fava beans, certain medications, or infections called rapid hemolysis of the red blood cells. And hemolysis, remember, lysis is breakdown, so breaking down or red blood cell destruction. Often the patient is asymptomatic at baseline, and in addition to normal anemia signs and symptoms, the patient might also experience jaundice, which is a yellowing of the skin. Treatment would include trigger avoidance. The patient's going to be educated about what their triggers are. And then if they have severe hemolytic episodes where too many red blood cells are being broken down, they may require blood transfusions or supportive care. Hydration is another important thing to stress for this patient or this population, because when so many red blood cells are getting broken down, the kidneys can get overwhelmed trying to filter out the parts and pieces of the red blood cell. So we want to make sure that the patient is drinking properly so that the kidneys can stay healthy as they filter out the blood. Next type of anemia is autoimmune hemolytic anemia. So autoimmune meaning the body's own immune system is doing something here. Hemolytic means breakdown of that red blood cell, leading to anemia. So autoimmune hemolytic anemia, the body's own immune system is breaking down and attacking healthy red blood cells. The way it occurs, the immune system produces autoantibodies that coat and destroy healthy red blood cells, causing a premature breakdown. Signs and symptoms include our normal signs and symptoms of anemia, as well as jaundice that can occur because when those red blood cells are broken down, we have an increase of bilirubin. Splenomegaly, so an enlarged spleen, dark urine related to the bilirubin as well. Treatment then would include medications that decrease the immune system. So corticosteroids, right? Your Sones and your Solones are immunosuppressants that can turn down the immune system so it doesn't destroy so many red blood cells, and other immunosuppressants may be used as well. If the patient needs, they can also have transfusions to replace red blood cells. Next, we have anemia related to blood loss. With acute blood loss, we see a rapid fall of the red blood cells, hypovolemia, increased risk for shock. With chronic blood loss, so they're losing a small amount of blood pretty chronically, we'll see a gradual iron depletion and iron deficiency anemia associated with it. Both acute and chronic blood loss will result in reduced oxygen delivery, pallor, and tachycardia for the patient, because both are going to deplete the oxygen carrying capacity of the blood. It's different mechanisms, but with both of them, you can end up in that spot. So with the acute presentation, the patient will experience a rapid pulse, hypotension because they're hypovolemic, dizziness, weakness, pallor. We're worried about hypovolemic shock. Treatment for this patient would be to increase the fluids, increase the BP, use fluid resuscitation, as well as blood product transfusion. With chronic presentation, you got fatigue, pale skin, shortness of breath, headache. You still might have the normal signs and symptoms, dyspnea on exertion, cold extremities, all that good stuff, tachycardia. The treatment here would be to identify and stop the bleeding source. So maybe they have a GI bleed that we need to address. And then also we could supplement with iron replacement therapy as well. So to wrap up, remember all anemia results in low oxygen within the body. So the big thing is that we determine the cause of the anemia, and that will guide our treatment. Remember, with iron deficiency anemia, we're going to give iron. B12 deficiency anemia, we're worried about protecting the nerves. Folate's important with pregnancy. Aplastic anemia, we're not just worried about red blood cells being low with anemia, but also we're worried about low white blood cells and low platelets, so infection and bleeding risk. And hemolytic anemia, think hemolytic lysis breakdown. We're worried about red blood cell destruction with hemolytic anemia.